Today, Nick came into my office and he showed me this article. And this article was like a Healthline article, everything you want to know about jaw implants. And he didn't tell me why he sent it to me. It was just a link, and I read it, and I'm like, dude, we've got to review this. We've got to have like my reaction to this article. This is ridiculous. And he's like, no, I don't know about the article's fine. I said, no, it's not. He goes, it's fine. I just want to know how you could be a reviewer for this website. And I'm looking at it. I'm like, this is not a legitimate article. There's so many inaccuracies about it. I want to talk about reviewing it. So the first thing I noticed is that actually it's reviewed by a legit board certified plastic surgeon that I've trained with and I respect. She's like a really, really good plastic surgeon, but she doesn't do jaw implants or anything like that. And it's written in 2020. So I'm going through this, and the article is entitled Everything You Want to Know About Jaw Implants. And as I keep scrolling down, other than the date being 4 years old, it's like fast facts, and it kind of breaks it down into the surgery overall, the safety, convenience, cost, efficacy, and other things. And so as we go down, I kind of just want to read this article and tell you why it's wrong. And the reason that this is a meaningful video to me is because not many people talk about jaw implants. Not many people know that you can even do it. So we're subjecting everybody to fillers all the time for the jaw angle, but it may be imprecise and it may be dangerous. And so raised awareness, a heightened awareness of this procedure is going to bring it to light. And I think the first thing I can do as a plastic surgeon who loves this procedure is to clarify some of the inaccuracies that's out there. The first thing is it says that jaw implants are an outpatient plastic surgery procedure that elongates the look of the jaw. It doesn't really elongate the jaw. Technically, a chin implant would elongate the jaw. If anything, it could widen the jaw or slightly elongate it on a vertical axis. But you don't really place an implant under the ear like it says, or the chin. A jaw implant is placed on the mandible bone, touching the mandible bone through an internal incision. It says it should only be done by a trained and certified plastic surgeon. As much as I want to agree with that, that's not true either. Oral maxillofacial surgeons and ENTs can also safely perform this procedure. The safety profile says that the procedure is generally safe, but all cosmetic surgery carries some risk. Of course, that's true. And side effects can include an allergic reaction to the implant. That's absolutely not true. Implant materials, including porous polyethylene, silicone, titanium, and PEEK, are biologically inert substances, and I've never really heard of an allergic reaction or rejection of any of these materials. As far as convenience, it says most patients will be able to resume most normal daily activities after 7 days of recovery. I guess, depending on what a normal daily activity is, that's probably kind of true, but you could be up and walking the next day. The procedure is done under anesthesia. I wouldn't want to be awake for this. And you'll need to arrange some time off of work and for someone to drive you home. These are two very basic and sort of umbrella type phrases. I love this. Under the cost section, it says the cost of jaw implants ranges based on a variety of factors, but typically surgery will cost $2,000 to $4,000 and will not be covered by insurance. Well, I do think in some cases it might be covered by insurance if it's a post-traumatic issue or you have a congenital defect, but for the most part, that's correct. But $2,000 to $4,000 is a gross underestimate. If you were to put fillers along the jawline, you might be expecting to pay that much. But the cost of the OR and anesthesia is typically greater than $2,000 to $4,000, depending on where you live. An implant can range anywhere from $1,000 for an off-the-shelf device to up to $10,000 for a custom device. I've even heard custom devices costing as much as $20,000 to $25,000. Then you have the surgeon's fee, which varies from state to state, region to region. So at the very least, you're looking at 5 figures for this procedure, but there are indeed a lot of factors that will give you a more precise estimate. As far as the efficacy, implants give the chin and jaw a more defined look. That's not true. It gives the jaw a more defined look and more balanced facial proportion. I agree with that. Jaw implants should last many years, if not permanently, if they're done correctly. That is accurate. And then it goes on to say, what are jaw implants? It says jaw implants are a surgical procedure. No, they're not. They're implants, which an implant is placed along the jawline to give the chin and jaw a more pronounced look. That's not really true. We're not talking about chin implants here. The surgery is a good option for men and women who feel their chin looks receding or small. Well, that's a chin implant, not a jaw implant. When done by an experienced plastic surgeon, jaw implants can help balance out the proportion of all facial features. That's one accurate statement. And again, they talk about how this procedure costs $2,000 to $4,000, but implants usually cost a heck of a lot more than that. So how do jaw implants work? Jaw or chin implants are typically made of silicone or a polyethylene known as Medport. Yes, Medport is porous polyethylene, but they fail to talk about PEEK, which is an up-and-coming device as well, and titanium, which are other options. The implants are designed to specifically fit a patient's individual face shape. In my line of work, I agree. I think custom jaw implants are the way to go, but no, traditionally, and especially in 2020, these were typically purchased as off-the-shelf devices that were not customized for people's faces, which made the procedure a little bit more challenging and less predictable. Then it talks about the procedure. It says you arrive at your appointment and fill out paperwork and go to the procedure. A nurse or a surgeon will give you general anesthesia. That's not true. An anesthesiologist will. And then yes, an incision is made and the implant is placed into a pocket. The jaw implant procedure takes about an hour. I'm pretty skilled and comfortable with this procedure, and I book it for 2.5 hours. Although in the best case scenario, we can sometimes do it in about an hour and a half. I don't think the procedure ever takes an hour. You should arrange for someone to pick you up. That's true, because anesthesia makes it dangerous to drive. Yeah, you wouldn't drive home from general anesthesia. So as far as targeted areas for jaw implants, it's the jaw. Risks or side effects, you get standard risks and side effects, but an allergic reaction to an implant, as they state, is not one of them. They talk about nerve damage, and that's a possibility as well. What to expect after jaw implants? Basically, you get your stitches removed after a week. You don't get stitches removed in my practice. You see results immediately. I don't think you do at all. I think it takes 4 to 6 weeks at least to really start to see the results. You definitely see swelling immediately, and your face is swollen and puffy for a prolonged period of time. It's kind of hard for me to keep going. When I look at the pictures here, if you were to take a look, the implants that are shown here are a lot larger than the implants we typically use. And I've never seen an implant as large as the ones that they're showing here in terms of height and projection. How to find a provider. Jaw implants should only ever be performed by a board-certified plastic surgeon, and it's a good idea to meet them beforehand. As I mentioned before, I like this. I like that it says that. It supports me. But the truth is there are great oral surgeons and there are great ENT doctors who can also safely perform this procedure. The bottom line is we have a deficiency of good, high-quality education about jaw implants, and this Healthline article is the best that we could find, which is really sad because when I typed, is Healthline a reliable source, the first thing that popped up is Healthline, which as Red Ventures company has sister sites, Medical News Today, Psych Central, and Health Grades, is not reliable. So when you Google about jaw implants, and unless you're like finding my website or my YouTube channel or other plastic surgeons' YouTube channels, this is kind of what you got. This is what society is working on. And so I feel compelled as a plastic surgeon who has a deep interest in this procedure to sort of shed light on this. And I hope this helps you better understand that it does behoove you to find a specialist, not who's a board certified plastic surgeon, but somebody who specializes in custom facial and facial implants. Talk to them and get the real 411 on how this procedure goes down. Thank you so much for taking the time to watch this video. If you have any questions, please leave it in the comments section below. Turn your notifications on, subscribe, so on and so forth. Take care.